Although it is typical to experience some amount of stress at opportunities, intense or consistent anxiousness might be a measure of a disorder. Such ailments are commonly diagnosed during maternity and are considered to be associated along with psychiatric disorders. Nonetheless, they may lead to an array of medical ailments, including anxiety, schizophrenia, or epilepsy. A lot of clinical depression and stress and anxiety conditions are affiliated with clinical disorders, such as clinical depression or stress and anxiety problem, although only clinical depression and anxiety problems are recognized as anxiety. Drugs are readily available to treat stress and anxiety conditions. The U.S. Food and Drug Administration, the nation's leading manufacturer of opioids, has prohibited them coming from the majority of its medicines, and it allows individuals who take certain prescription medicine to take their own prescription under an independent method. It additionally enables patients who have mental ailment to obtain the medicine if they really feel it will definitely make them a lot more effective and risk-free substitute for an opioid when their state of mind and stress are higher. An individual might take these on your own or in combination along with cognitive behavioral treatment, CBT, or yet another kind of treatment. Such therapy is usually made to decrease worry. The very first treatment program is probably a lot more successful at reducing social seclusion that may be due to the absence of emotional attachment to a person or team. A great deal of clinical depression and anxiousness have been affiliated along with liquor participation, but the certain connection between booze and alcohol make use of has not been understood. The condition stress includes emotions of worry, fear, and unease. There are 3 styles of stress that people experience when they are depressed, and approximately 40% of people mention feelings of despair or anxiety after they are depressed. What does the noodles indicate for me? While depressed individuals typically experience clinical depression themselves, there are lots of other essential facets of the brain that add to our anxiety and clinical depression. Depending on to a number of huge polls, up to this article talks about the primary styles of stress medication and provide their dangers and edge results. The write-ups through the authors, featured in this area, are specified through the main strategies of drug for anxiousness. The end results of these researches are released depending on to the conventional tips, a collection by the government. The seekings are located on a group of 100 folks, age 55 and more mature, in Israel and in Northern American cities, consisting of Toronto, Washington, D.C., and Seattle. A number of styles of medicine can manage the signs of stress. Various other treatments that can easily strengthen symptom management can be medications that aid you maintain your brain functioning on a greater or lesser routine. In specific, some drugs assist you stay away from consuming or drinking. Some drugs can assist you stay awake longer. However, various other drugs can meddle with the functionality of your eyes. For instance, it can lead to the body to lose its capacity to acquire into or out of your muscles. Depending on to the Anxiety and Depression Association of America, ADAA, the 4 major courses of medications for anxiety conditions are 1. Antidepressants, 2. Discerning serotonin reuptake inhibitors, 3. Anti-epileptic medications, 4. Serotonin reuptake inhibitors, 5. Amiodarone, and 6. Fencycline. These drugs likewise possess edge impacts, featuring clinical depression, sleep problems, insomnia-related bodily and mental fatigue, hassles, or seizures. Discerning serotonin reuptake preventions. Although particular serotonin reuptake preventions, SSRIs, are a type of antidepressant, doctors can easily prescribe them to people with stress and obsessive compulsive disorder, OCD.